Yeah, Jim, well, it's the same message that medical providers have been sharing with us for what seems like months now. For folks who are unvaccinated, come get the vaccine. But in the battle against COVID-19, as well as online misinformation, they've published this letter asking the public to come place their trust back in caregivers and also place their trust in the vaccine.
I want you to trust me. I'm your doctor.
An open letter.
So we kind of groundswelled up. The providers said, hey, let's send a message. Let's figure it out.
To our community.
All of us as providers, we're kind of getting tired.
In that fatigue, the pen went to paper. More than 150 medical providers at Tidelands Health asking for neighbors to get vaccinated and even more, to put their faith back in medicine.
They've trusted us with that for decades. You got to trust us now.
As of today, more than 656,000 people have been infected with COVID-19 and more than 10,000 people have died across South Carolina. One glimmer of hope today, more than 50% of the eligible residents have been fully vaccinated.
With all due respect, this wasn't a letter of complaint. It was a letter of how can we get the messaging out so that more than 50% of our unvaccinated population can see what we're seeing every day.
Dr. Gerald Harmon says they see children forced to say goodbye to their parents, some younger than medical providers, all succumbing to the virus. Doctors and nurses carrying an 80-hour workload, all of them vaccinated, saying they're proof that there is a solution to the suffering.
This is a mission that we're on, to save lives, to save our community, and to keep people healthy.
In Thailand's other medical centers, as well as some local pharmacies, they've been putting in that overtime to get shots in arms, and it is reflecting in some of the state numbers. As the SCDHEC reports that Georgetown County is, in some cases, number 2 in the state when it comes to vaccination rates.
She says right now South Carolinians are suffering avoidable deaths. She released new data from August that shows 75% of people who died from COVID-19 in South Carolina were not fully vaccinated. She says 98% of those who were fully vaccinated and died from COVID had underlying medical conditions.
We have excellent vaccines. These are some of the most effective vaccines ever created, and yet they're underutilized.
South Carolina's assistant epidemiologist, Dr. Jane Kelly, sharing what worries her, specifically pointing to reports from the South Carolina Children's Hospital Collaborative. Their latest showing 35 children fighting the virus in the hospital, 7 of them on a ventilator.
One recurring theme that is so disturbing is that the majority of those cases of kids who are over age 12 who are in the hospital with severe illness are unvaccinated.
She says the vaccine is the way out of the pandemic, and without it, the virus has more opportunity to spread and mutate, creating new variants.
We have a pandemic of misinformation as well.
2 doctors with Johns Hopkins University taking on that same topic, stressing the shots are safe.
We have more safety data on these vaccines probably than any other vaccine currently used here or anywhere.
Dr. Anna Durbin says 1 to 2 people per 100,000 risk a blood clot with the Johnson & Johnson vaccine, and 5 in 100,000 risk severe allergic reaction with the mRNA shots. Dr. Kelly sharing their strength as well, pointing to the science.
They are effective against the Delta variant, against all the variants that are currently circulating in South Carolina, and in keeping individuals and their families safe.
DHEC leaders have now added the number of students across South Carolina that are isolating and are quarantined, which I have pulled up right here. Now, this will be updated every Wednesday, and you just have to click right there to pull up a PDF page with all of the schools. Dr. Kelly says it'll serve as a better real-time picture of how COVID is affecting our schools. Yeah, he says he was so excited to get his son back to school when they registered for classes last summer, but since then, rising cases have changed his mind. He says he can't sit around and wait for lawmakers to change their restrictions, so he's taking matters into his own hands.
9,000 and then 10,000 and then 11,000. It's like, are you kidding me? I mean, you've got 11,000 kids in Horry County that aren't allowed to come to school.
As Jeremy Nicolau watched the number of students in quarantine and isolation rise, he knew this was a different situation than when he registered as 5th grader at Myrtle Beach Elementary months before.
I do want my child going to school, having that social, he needs that social interaction. But at the same time, I am not willing to risk his life for social interaction.
In June, lawmakers passed a budget proviso saying all virtual programs are capped at 5% of the district's student population. For each student over that limit, the district loses 47.22% of the state per pupil money. He was told he had to send his son back to school in person.
It feels like they're pushing things off and seeing if things will change with time. Well, time is not the answer.
He enrolled his son in virtual homeschool because he says the risk is too high to wait.
My son just lost his aunt 2 days ago because of this. Down in Arkansas, she just passed away from the Delta variant.
Now, I called the two people who can call the state Senate back into session and consider changing the budget proviso, Senator Harvey Peeler and Rep. James Lucas.
We're unavailable to take your call.
While I haven't heard back, Senator Peeler's office announced shortly after that he's calling the Senate back on October 12th. Lawmakers have not said if they'll talk about the school rules or not. Now, there are some schools that have had to go back to virtual learning because of a rise in cases or quarantines. The state rules say as long as it's temporary, schools will not be penalized.
Yeah, Jennifer, everybody I spoke with today agree that testing is important now more than almost ever, and there's a need to expand access to everyone.
I don't want this to be our new normal.
Healthcare leaders have seen a lot these last couple of years.
I hear of many families who are losing not just to hospitalization, but actually having multiple family members die from this.
And for Care Team Plus's Johanna Haynes, the frustration only grows these days as COVID-19 numbers steadily climb.
Horry County is still per capita one of the hardest hit counties.
Though tragic, people are trying to get back to their idea of a new normal. School doors are open, people are returning to the office, and in some cases need a negative COVID-19 test to go back in.
The schools starting and the number of exposures that we've had in schools in both counties, that's really created a huge demand for testing.
But there's a concern. Both Tidelands and Care Team Plus have limited testing supplies, and they're facing staffing shortages.
So we've been focusing now for this surge on our symptomatic patients in our ambulatory clinics and in our hospitals.
It's hard for me to not be able to provide testing.
White House leaders want to expand access to COVID tests.
What is the administration's plan to expand access to testing right now?
Well, look, the president launched a comprehensive, bold plan last week.
A part of Biden's plan is to invoke the Defense Production Act to supply rapid COVID-19 tests.
The plan also includes sending about 25 million free tests to community health centers and food banks across the country.
Though more tests may become available, what about manpower?
We continue to do everything we can to support states in the surge, whether it's around staffing, whether it's around testing.
And Dr. Bashar says the federal government has deployed around 1,000 medical professionals to help at medical facilities across the country. He also says the Biden administration is spending around $2 billion to buy more rapid testing kits.